clients that I have questions about.
Yeah,
First
great.
one's a woman, 60 years old.
Mhm.
About 6 months ago, 6 or 8 months ago, she started having pain in her right knee. She went and saw the doctor, and they did some x-rays and tests, and they basically said she's bone on bone. Uh,
Okay.
what can we do?
So I mean, you're basically managing a situation that, um, whenever she's moving it, she's going to be irritating it because it is bone on bone. There is no lubrication or padding slash lubrication. And so, they are making strides with like certain kinds of injections and things. And so if you can keep her comfortable, and if she pursues that, she might find some relief from that. But as far as, old school way of looking at it, you're not able to make the cartilage grow again because it's not something that has its own blood supply. It's a lot like your fingernails or your teeth or something like that. And so, um, really what you're doing is you're trying to increase blood flow to the area. You're trying to keep the lymphatic function happening as well as you can, and reducing spasms in the area.
Okay.
There's always potential issues with like inflammation and the joint capsule getting inflamed and tendonitis and things like that. And that stuff you can kind of troubleshoot, but the three big ones are lymphatic movement, blood flow, and the movement of lymph in the area. Because it's bone on bone, there's going to be constant material that needs to be cleaned out of that joint. And
Mhm.
you're wanting to keep blood going to that area just to keep it as comfortable as possible. If there was still a little bit of cartilage left, the increased blood flow would help to like save that cartilage. But when they're bone on bone, it's still about keeping the bone and that joint as healthy as possible and getting blood to the area. But you're really wanting to just keep her as comfortable as possible.
Okay.
She's going to have more issues with more movement, especially weight bearing movement. And so her exercise, like if possible, uh, things that are potentially like non-weight bearing, like things in a pool. I mean, like getting on an exercise bike can be okay, but even the repetitive motion, if you're doing like 70, 80 revolutions per minute, that can actually even be somewhat aggravating to it. And so,
She's a golfer, and her measurement of how good of shape she's in is if she can play this one particular course all the way.
mhm, okay.
So,
Yeah. I mean, just keep her as comfortable as possible. Like, so again, going to like the joint relief, something that's lymphatic in nature, um, uh, the lymphatic blend, chocolate root cleanser is also a very good lymphatic stimulant. Um, even the pepper, any sort of pepper will keep the circulation going and help to move the lymph through the area. And the joint relief will increase blood flow and reduce spasms. And then you can augment it with things that are antispasmodic. And the one that I kind of like to use, you can go marjoram, you can go things of that nature, but you could also in this particular area, you could use like basil or petitgrain, or there's that blend spasmophilia, and you're getting a couple things here. You're getting a physical component and you're getting an energetic component. And the physical component is they're also very antispasmodic. The blend joint relief has some antispasmodic properties, but sometimes you need to augment that a little bit more. And so the basil and the petitgrain are very good for reducing some of that. But the thing that it does really well is it helps to unwind like those inner health rays. There's the outer health
mhm.
rays and inner health rays. And so there are just this lines of energy that continue from the pores of the skin inward. And the more that you can kind of keep that unwound, the more like energy or life force can get to it, and it just keeps everything as functional as possible. Like any sort of arthritic condition, you're really dealing with a lot of depletion in that part of the body. Not necessarily the whole body, but it definitely in that part. And so by opening up those health rays, you're getting more energy flowing through that joint than you would otherwise. So you're kind of getting a couple different things happening there. Where if it was just like a sprain or a strain, I'd say, go marjoram, go, do just a bread and butter oil like with something like that, and it should knock it out. But here I'd probably switch over to like basil or petitgrain or something of that nature. And she sounds like she's still pretty active.
Yes.
One thing that like we don't ever really talk about a whole lot in a situation like this is also to treat the skin over the area to still stimulate lymphatic movement in the skin itself. Because the skin can be a reflection of poor lymphatic movement, down deeper. And anytime you stimulate lymphatic function in the skin, it actually stimulates the organs of blood purification, which is really kind of critical in arthritic conditions. So it will stimulate, the kidneys, the liver, the spleen, the lungs. And so, you can use things like coffee, you could use parsley, you could use celery, carrot, any of the ones that are real good skin cleansers. Um, it wouldn't be like the top thing on my list to do. Like those other ones are much bigger, like fish to fry, so to speak.
Okay.
But when you're really looking at like long-term treatment, keep in mind that you want to keep the skin in that area as healthy as possible.
Okay.
It's not so much like, oh, it's getting eczema or oh, it's getting, a rash or something. You're really looking at how well is the skin in that area detoxifying? Because if it's toxic on the surface, it's going to have fascial restrictions and poor lymphatic movement down below. And so you stimulate the stuff the way that we talked about. But if the skin is real congested in that area, um, it makes it harder and harder to treat over a period of time. And one of the ones that's really good for skin congestion is helichrysum. Helichrysum can be quite good in this. So even the use
Okay.
of like lavender just by itself can be kind of helpful for like the spasms and the energetic component. And lavender does have some properties that are good for like spasms and pain relief. It's not the top pain reliever, but it does reduce some nervous tension. And in a situation where a joint is compromised, the nervous system in that area tends to get a little bit like aggravated, you could say, and like overstimulated. And so, yeah, I would keep that in the mix. And, as long as she's staying active, I mean, I'd keep treating it. It will need to be treated consistently.
Okay.
I would say treat it before it becomes a problem, because at some point when you have a joint issue, if you just keep waiting till, there's a fire, um, at some point you're not really able to put the fire out, and that inflammation and that inflammatory material becomes systemic. Like it just starts to travel throughout the whole body. And if you stay on top of it, especially with her active lifestyle, she'll know when it starts to flare up a little bit, like, maybe I should stay off of it for a few days. And, rest would be important, but, if she's playing golf and everything, like definitely have her see the doctor as well.
Right.
And, there are these new shots and things that they're doing. And, things now there's a lot more potential for her to like avoid a surgery now than say 5 years ago, especially like 20 years ago. 20 years ago, this would just be surgical. But these days, I mean,
Okay,
it still might come down to that, but you can keep her relatively active as long as she doesn't overdo it.
so going
Yeah.
back to the first set, the joint relief, how
Mhm.
would you apply that?
With that, I would probably put it on with like some sort of base oil. Like I like sesame for this because sesame by itself is a lymphatic stimulant, just with no essential oil in it. And so when you're looking at things like joint issues or muscular issues, or you're trying to detoxify the body, putting essential oils in sesame oil is significantly more therapeutic than just say, like a almond oil or a grapeseed oil or something like that. And so I like to go sesame oil with this, but
Okay,
other things will work, but sesame oil is, it's not expensive unless you get the really fancy stuff.
mhm,
And it's a lot of bang for your buck. And I mean, sesame oil is almost as therapeutic as the essential oils themselves. And so to combine the two makes it an even more potent uh, ointment. Yeah.
okay. And then you talked about basil, petitgrin, spasmophilia, marjoram.
That
Uh, how will we do those?
you could put it on like with alcohol or witch hazel.
Okay,
Yeah.
so like a body tonic.
Yeah, body tonic, liniment, whatever version of that you would want to do. That way
Okay,
you can actually put that on, let it dry, and then put the ointment on top of it. And you really wouldn't have to have very much time in between the two. You could just put it on, let it dry, put the ointment on, boom, you're kind of good.
okay. And then helichrysum, again,
I,
body
I would
tonic.
rotate that. Yeah, I would rotate that from like maybe once or twice a week. Like it probably
Okay,
doesn't need to be that much unless it's helping her with some pain management, which is always possible. But for the skin, I'd just say like once or twice a week. And that one, it doesn't kind of matter how you put it on. It could be a liniment, a body tonic, a massage oil, even a little bit just neat, like
okay.
any of that would. Yeah.
So how would Lovage body tonic do in this?
Yeah, lovage is very good for cleaning up the inflammatory material. And so I would treat probably the whole leg with it other than just the knee. Like the issue with anything that's bone on bone, a little bit in the spine, but more like hips and knees, it's generating a lot of inflammatory material that goes through the body. So by putting the lovage on, you're helping to clean up the soft tissue of that inflammatory material. And lovage is also a little bit of a diuretic, so it increases the urination and the quantity of how much you would urinate. And in arthritic conditions, you're wanting to reduce the amount of deposits that would be like uric acid, lactic acid, crystalline deposits, things like that into the joints, because that is part of the arthritic, issue. That is part of the arthritic condition. And so augmenting with things like lovage and things like that, very, very helpful. Yeah.
Okay. So moving on to